South Sudan has one of the highest under-5 mortality rates in the world, with 1 child out of every 10 dying before their 5th birthday. Children die from easily preventable diseases such as diarrhoea, malaria and acute respiratory infections like pneumonia. And many mothers also die from lack of basic medicines and care. Malnutrition among children is a contributing factor that increases complications and the likelihood of children dying from these easily preventable illnesses. The states of Unity, Upper Nile and Jonglei, and 2 administrative areas in South Sudan, have the highest rates of deaths compared to the rest of the country. These are the most remote regions in the country, and many people here have limited access to basic healthcare and medicines. That is why the Ministry of Health, with support of the World Bank and UNICEF, is implementing a health programme in these 3 states and administrative areas to provide life-saving services. The programme provides an essential package of health services that includes support for vaccine storage and supplies, including cold chain materials and vaccines against measles and other common childhood illnesses. By March 2023, the programme has immunised over 180,000 children against measles. The project, which is funded by the World Bank, also focuses on COVID-19 vaccine deployment in the country. It supports training of health workers who inform communities about safe behaviours and creating demand for vaccines and health services. This programme, building on the one that was initiated in 2018 to provide essential healthcare to the vulnerable populations in the 3 states and 2 administrative areas. The World Bank supported project supports the provision of basic health supplies and medicines and supports vaccine transport and deployment. This includes the provision of critical equipment such as boats to deliver supplies to communities in hard-to-reach areas, which are flooded for almost half the year. Since the programme was launched, it has helped to facilitate the delivery of thousands of tonnes of medical supplies and medicines. Considering the remoteness of these regions and the lack of infrastructure, interpersonal communication by community mobilisers and health professionals is the only way to reach these women and children. The project provides training on basic healthcare and detection of common illnesses, and a large component of it focuses on antenatal care and advice to expectant mothers. To date, the programme has provided antenatal care services to more than 76,000 pregnant women in Unity, Upper Nile and Jonglei states. The Boma health workers reach out to mothers and to caretakers and provide advice, medicines and referrals to the healthcare centres and to other healthcare providers. The training of health workers has resulted in them providing over 7 million consultations to community members, which is quite a remarkable achievement. The programme has provided critical medical equipment and supplies, including for this operation theatre, which has been instrumental in saving lives by providing elective surgeries to community members. This has helped to save many lives of men, women and children, and also provides emergency obstetric care to expecting mothers who are brought to the hospital. These facilities and the trained healthcare professionals provide antenatal care and child health services and are helping to save many mothers and infants. Over time, this will help to lower the rates of maternal mortality and infant mortality in these regions.
Is it finished?
Immunisation rates in South Sudan are among the lowest in the world, and almost half of all children under 5 haven't been vaccinated. This results from a combination of factors, including the unavailability of vaccines to lack of storage and proper handling of vaccines. The World Bank-funded programme supported the provision and solarisation of large-scale cold chain systems where vaccines are safely stored and transported when they are needed. This Vaccine storage and cold chain system has played a major role in increasing overall immunisation rates and COVID-19 vaccinations over 65% of the target population across the country. The Ministry of Health, with support from the World Bank and UNICEF, is working to save lives and to ensure continuity of health services in the targeted regions. Although the programme is helping to change the lives of many, there is still a need for increased investment in the health sector and for building a broad coalition of partners to support health services in South Sudan. Ultimately, access to basic healthcare services means healthy children and mothers and happy communities. In time, this will enable South Sudan to move towards achieving its child and maternal health-related goals.